Africa Population Plan. South Africa is a country with 59 million people. It is located in the southernmost part of Africa. There are 9 provinces and 3 are the main capital provinces. The economy is mainly stable, but of course some people have more money and others less. The crude birth rate is mainly stable throughout the years, but in 1948 the government made a rule for families to reduce the number of kids they were having in order to maintain the population and prevent overpopulating. This worked and the population has decreased ever since. The crude death rate in South Africa was very up and down. In around 2017, the tuberculosis epidemic killed around 360,000 people, but it has been relatively stable ever since. The life expectancy in South Africa was mainly stable until a sudden drop in 1919 due to the influenza, although it has increased ever since. But then at around 2004, HIV and AIDS started sprouting, reducing the life expectancy, but since then it has begun rising. The fertility rate was mainly similar throughout the years, but at around 1948, contraceptives were introduced, reducing the number of kids people were having, but then in 2006, the funds for contraceptions went to HIV and AIDS, and there was less protection provided. The infant mortality in South Africa was up and down the whole time, and when HIV occurred, it went higher up because women with these diseases were birthing children and passing down diseases to them, which made it very hard for them to survive. Next up, we have these 3 population pyramids. They're all very different. In 1960, the shape of the pyramid was very obvious as there were more kids compared to anything else. In 2020, the shapes are going to form into a very big and a very similar shape apart from the elderly group. And then we can see that in 2060, it is predicted for everything till the age group of 55 and onwards to be almost the exact same. Next up, we have the distribution map. This shows the 9 provinces. In the Northern Cape, we can see a large space with hardly any people. Then the Western Cape has more people in the coastal areas, yet it is still a smaller space than before. Then we have the East Coast, which is very crowded considering the size of the area. And lastly, the Center North, with the most people taking up about 1/3 of the country's land. What is the population problem in South Africa? One problem in South Africa is the droughts. These droughts leave people in horrible living conditions. They make people need to walk far to get to water, children not going to school to help their mothers at home, also leaving the economy in a bad place because they cannot build infrastructure, and less jobs for people to make money in. Another problem is not having good education for people, especially with contraceptives. These mean that people can have more sex, even though the fundings for the contraceptions would have decreased because it went to something else, and this could lead to an increased population. Lastly, another problem is finding a permanent solution to the water crisis. This would help sanitation and the economy. How can we fix these problems? One policy to fix the drought and the social effect is to stabilize places that are less economically advantaged. This would teach citizens how to collect their own rainwater and fog, and also have a water tanker provider. These options are cheap and quick and will allow the country to get more water for communities and to build for infrastructure, which would give time to rebuild their economy and get more money to find a long-term water solution. Another policy is to give females and males more education during their school years about safe sex. This will allow people to be safe by reducing the chances of having children, which will maintain the population and prevent overpopulation. But they will also be aware of the consequences without always needing contraception, because the funds for contraception will be reduced because they will go to HIV and AIDS. Lastly, a long-term policy for water solution after there's more money for less economically privileged locations is to create a pipe flowing from the ocean and going to the country with an attached filter. This would allow the water to disperse to different locations. Mothers would not need to travel as far to get to the water pipe, as it could lead to few wells in villages. The kids would not need to help their mothers, and they could go to school and get more education. And of course, the water will allow people to access more sanitation and increased health, and the land could get more water, and the cracks and dryness would fade over time. Hopefully, these policies will help the country. Here are the citations.